Did you know that compared to people without neurodevelopmental disorders, individuals with NDDs like autism spectrum disorder, fetal alcohol spectrum disorder, and cerebral palsy experience higher rates of mental health problems with more severe mental health symptoms? Mental health problems are a common and significant source of stress and even crisis for families. And these families experience more emergency department visits due to mental health related difficulties compared to those in the general population. Hello, my name is Dr. Teresa Jubenville Wood. I'm a registered psychologist who specializes in working with the mental health needs of autistic adults. Today, I want to share with you the vital connection between neurodevelopmental disorders and mental health problems. In fact, there's significant overlap between NDDs and mental health problems. For example, according to the American Psychiatric Association, 70% of individuals with an autism spectrum disorder will experience a diagnosable mental health problem, with approximately 40% of these individuals having multiple mental health problems. So what are some common types of mental health problems? Well, anxiety and depression tend to be the most common types of mental health problems for autistic individuals, but there are certainly many other forms of mental health problems that these individuals might experience, such as obsessive compulsive disorders, alcohol and drug abuse, eating disorders, bipolar disorders, schizophrenia, psychotic episodes, among others. Outside of formal mental health diagnoses, research studies have shown that people with autism spectrum disorder and attention deficit hyperactivity disorder also experience high rates of self-harming behaviors and are more inclined to commit suicide. Actually, mental health problems in individuals with NDD have been associated with poor life outcomes, such as impairments in day-to-day living skills, difficulty finding a job and living independently, and in general, a reduced quality of life. So attending to the mental health needs of people with NDDs is crucial. For children with ASD, anxiety symptoms may begin as early as preschool and become more pronounced as a child enters adolescence. This may be due in part to the beginning of puberty, which marks a number of physical and hormonal changes, and it's perhaps further complicated by the transition to middle or junior high school, which will bring new expectations and even a loss or change in supports. Children with ASD and ADHD are also particularly vulnerable to being bullied, rejected, and abused by peers. These traumas will certainly impact negatively on one's mental health. Even as an individual ages into adulthood, co-occurring mental health symptoms do not diminish. Many autistic adults continue to experience mental health problems throughout their adult years. I want you to know that anxiety and depression can range from mild and occasional symptoms to more pronounced and debilitating symptoms. Seeking help early on, at the first sign of mental health problems, can lead to earlier intervention and support that can have more promising outcomes. It is possible that depression and anxiety may look different in individuals with ASD. For example, it may be difficult for a child with ASD to understand their own internal experiences and express how they feel. I'm happy to say that over the past several years, there's been increasing support for cognitive behavioral interventions to help children, adolescents, and adults with NDDs to manage their symptoms of anxiety and depression. If you're interested in finding out more about these various support options, I encourage you to visit the resources section of this module.